doctor ordered a set of a cardiac assessment and a respiratory assessment, and then we're just going to go over some safety tips afterwards. Is that okay with you? Okay. Can you confirm your name, date of birth, and age for me?
John Andrews, 3/21/56, and I'm 69.
Okay. Can I just see your wristband real quick? All right. Perfect. So before we begin, do you have any allergies or are you on any medications?
Yeah, I'm currently on 4 medications.
Okay, can you let me know what those are and the dosages?
Yes, I'm taking Ascorvastin, 80 milligrams once a day. I'm taking Lisinopril. It's 10 milligrams once a day. I'm taking Amlodipine at 5 milligrams a day, and I'm taking Plavix blood thinner at 75 milligrams a day.
Okay. So, taking all that, do you have any diagnoses of anything?
Yeah, I have arterial sclerosis, and they're treating me for that, high blood pressure, hypertension, and cholesterol. I had a heart attack 2.5 years ago.
Okay.
And I have 4 stents.
Okay, 4 stents. So, they did your vitals before we came in and everything, is that right? And they got 124/73, a pulse of 60, and your respiration's 18.
That sounds great.
All right, that's great. Okay, so the first thing that we're going to do your cardiac assessment, and I'm going to check your jugular vein distension. So if you could just slouch in your chair for me, because we normally do this at a 30-45 degree angle.
All right.
Okay, and just look over there real sharp. Okay, that one's good. Now let's go over here. All right, perfect. So next we're going to check your pulse points.
Okay.
I'm just going to check 2 up here. All right, those are good. That's your radial pulse. You got a 2+. I can feel them well. And then let me check your dorsal pedal. All right, perfect. So now I'm just going to check your other pulse points, okay? So it's your cardiac, carotid, your auxiliary. Let me check your brachial. We just did your radial. Okay, we're going to do your femoral. Okay. Now we're going to do your popliteal. Can't ever say that one. Okay. And these one more time. Alright, I feel all those at a 2+. That's perfect. Alright, now we're going to do your cardiac assessment, okay?
Okay.
Alright, first I'm going to check your equilibrium. You don't have to breathe when I do this. This isn't.
Oh, okay.
Yeah, you just have to sit there. Okay, now your pulmonic valve. Okay, now your Ebars valve. Okay, your tricuspid. And your mitral. Okay, they all sound good.
Great.
Alright. Now now let me check your capillaries. And that's just to check the blood flow. Okay, 2. Your feet.
They change color, huh?
You press them down, and if they change color within 2 seconds, you're good.
Yeah.
Alright, now can you roll your sleeves up? I just need to check your edema, if you have any edema.
Edema, what's edema?
It's just pitting if you have fluid,
Okay.
build up.
Kind of like swelling or something?
No, and your temperature feels good. Okay, let's check this. Okay, and your temperature feels good, perfect. Alright, now we're gonna, before we do that, I do have to ask, are you having chest pains today?
No.
Okay, so nothing going on today, just regular
No,
checkup?
feeling pretty good.
Okay, now we're gonna do your respiratory assessment. Can you just take a few deep breaths for me? Let me just see the pattern of breathing that you have. Okay, your chest inflates evenly. You don't have any barreling or anything like that. Perfect. All right. Now this is every time I touch you, you're gonna take a deep breath. Okay, we're gonna do 4 up here, 4 in the back, and 2 laterally. Okay. anything up there. Alright, now put this arm across your chest and grab your shoulder for me.
Okay.
Alright, and now just the other arm to your shoulder. Okay.
That it?
Yeah. And while they all sound good, you sound clear and everything. And while I still have my stethoscope on, let me just check your apical pulse. Sounds good. Alright. Now, have they informed you on the turn or get on your turn? You take a deep, or you cough and then you take a deep breath?
No.
Okay, that just helps you whenever you're short of breath or you feel like you can't take like a deep breath or anything like that. So what you're gonna do is you're just gonna lay down, turn on your side, take a cough real deeply, and then take a deep breath, and it should clear some stuff up. And then whenever you had your heart attack, did y'all have like an incentive spirometer in your room? It's that little thing that you blow into the nurse will bring in.
See how my volume was?
Yeah. So whenever like, you know, you're laying flat for a long period of time, like after you have surgery, your lungs can get like sticky and they won't inflate all the way. So what we use with that is we just try to get you up to a higher level just to like kind of work your lungs out. Like, you know, almost like you're taking your lungs to the gym. Okay. So while we're here, are you having any shortness of breath or like, you know, you're having a cough or anything like that?
No.
Okay, perfect. All right, well that does the respiratory assessment. So now we're just gonna go over safety tips. You know, since you have multi-diagnosis, you know, from the Morris-Fall scale, you know, you are at a little likelihood, you're at like a low risk to fall. Have you fallen like in the past 3 months or anything?
No.
Okay, so you're just at a really low risk just because you have multi-diagnoses and you are on a lot of medications, especially like heart medications. Like, you know, a lot of times if you don't take your blood pressure before that and like say it's low and then you take medications to lower it, it can drop, and then, you know, you may have a risk to get up and fall because your pressure is low and everything.
Get dizzy.
Yeah, just like that. So I'm looking around this room and everything, and I see this rug isn't like, you know, put to the floor. I think it would be a good idea for you to get this, like, just get some sticky tape and put that to the floor and everything, including this little thing that you have up under here.
Yeah.
And I wouldn't necessarily recommend y'all keep that rolly chair because, you know, I can do it. Anybody could do it. You could like slip back and fall and then hurt yourself or anything like that.
Yeah, that's happened before.
Yeah. So, and then, you know, I see like pointy things right here. It's easy to really hit your head, especially like, or like stairs or anything like that. Do you have like any animals that get up under your feet?
I have a dog that, she gets up under my feet. So.
Yeah, that's like one thing to look at too, because it's really easy to fall and everything. And as like for your medications that you take, do you put them like, you know, in a day-by-day thing, like a little capsule?
I have a day planner that
because
take them every day at the same time.
Okay, because I know it's easy to forget. I forget things all the time too.
Yeah.
All right, well, that should be everything. Are you feeling good about today?
Yes, ma'am.
Okay, do you have any questions for me or the doctor?
No.
Okay, well then that is it. He'll come in and see you shortly, okay?
All right, thank you.